The country has seen a number of service delivery protests recently, and these are expected to get worse as the local government elections draw closer. The Public Protector has just released a number of reports looking into the issue, and of course these are quarterly reports. Khayelihle Khumalo following the developments for us and joining us now on the Midday View. Kaya, good afternoon. So what's been happening there with the Public Protector's latest quarterly reports?
Well, that's right, Braden. Quite a very comprehensive report regarding some of the healthcare facilities in the country, focusing into the provinces. We know that with the advent of coronavirus, there has been quite a number of challenges in terms of the systemic deficiencies, in terms of the lack of laundry, among other things. And the Public Protector really joins us now to really look at this report. So that really paints a very bleak picture about the state of affairs of these healthcare facilities. So thank you so much indeed, Advocate, for joining us. Once again, just give us a sense about the importance of this report. Obviously, there are remedial action that you're pushing for, but how bleak is the situation for these facilities?
The situation is very much bleak, very horrendous, I must indicate. When we visited the hospitals, and that's what our people are still subjected to. But then I must indicate that when we were engaging with the officials, our officials in the various provinces, visiting, going back to the hospitals, working with the management of those hospitals, they at least implemented some of our interventions because they started making changes, employing more professional nurses, creating more spaces for your maternity ward. Because, for instance, in Mpumalanga, where the maternity ward, it was just having 2 beds, no place for privacy, no place for more women giving birth. And I mean, they were saying they're delivering 15 to 18 babies in a day. So you would find situations in Ignobel and Mulej. Yes, I indicated that apparently the communities are saying once you go to that hospital, you'll never come back because of the deplorable situation which is there. And I must indicate that when we were visiting the hospitals, we were also engaging with the organized labor, the staff, because we also wanted to make sure that the staff's working environment is also improved. Therefore, if you have a happy health provider, will be happy to provide service to the patients. But I must indicate that it's still a long way to go. For instance, the public hospitals, it's still not yet improving, but this is a starting point. We are saying use our reports going forward, implement our remedies, let's work together, because as an institution, we are here to help you to improve and strengthen constitutional democracy, because these reports, if you are a true CEO, I think you've heard we spoke about risk management committees, where you would plan in advance, make sure that you don't face a situation where when there's a disaster, you are caught napping. So that's what I would say.
And just once again, Public Protector, now with regards to the remedial action, so you have a time frame that you have given out. Maybe just shed more light in that regard.
Yes, our remedial actions, normally we would say to the institution, especially the HODs of health, the MECs, and as well the National Department of Health, but more specifically to the accounting officers who are expected to, we are saying to them, give them possibly 30 days to 60 days. In fact, all of them, we said 60 days, for them to prepare a plan according to what remedies we are proposing. Because when we say 60 days, you then have to tell us, okay, we recommended that you build more wards for maternity, and you can say in your plan, we are now planning, we've appointed the following company, we have the following time frames, and this will be done by this particular time. Where we've said to them, you need to appoint a company which will provide laundry services, That process as well, we are saying in that 60 days, compile a plan and plan for appointing. So that plan will then be detailed and will be telling us this is the time frame we are planning. And if you could hear other remedies, we are saying approach your provincial treasuries so that with the next financial year, you budget for all those issues, and then so that when you come the next financial year, you have money, you can appoint either additional staff, either additional equipments, your various PPEs because they are still needed, and other equipments which are there. And I must indicate that we will work closely because our officials, like I said in Mpumalanga, they must still go back and check, because you remember I said some of them were saying by the 30th of September would have appointed another company for the provision of the laundry services, whether that has been done. In Mkhwebane, you promised that you will be moving the X-ray room, because what we saw when we visited, it was a deplorable situation. You go to Lilian Ngoyi, the promises which they have made, and are they still maintaining them? So this is there as a tool for them, because as well, considering the service delivery protests, considering the service delivery challenges the country is facing, now every political party is busy campaigning, and we are saying to them, read this document. That's how it will help to improve the health system in the country.
And just quickly, PP, the issue around digital vibes, you say so far no complaint?
There was no complaint which was lodged with the public protector. And I must indicate the SIU has done the work. They've, well, unfortunately, yes, their remedies are not binding as the public protectors. And I hope that whatever criminal activity which has been identified, the law enforcement will deal with that, because remember, the public protector, we would have recommended future processes to follow, because even this report, we are saying, going forward, don't repeat the following mistakes. Going forward, this is your blueprint to use. So even in the digital vibes, the current Minister of Health, what are the do's and the don'ts they shouldn't be doing when you are an executive and involving yourself in such procurement-related issues? You have an accounting officer who also knows that they are bound by the PFMA, and you need to follow that to the T, and your supply chain managers, your CFO. So I think our reports most of the time, when we issue them, are helping to uproot and prevent future maladministration. And we know maladministration is a fertile ground for corruption. I always say that. Once you put systems in place, then you will never have such problems.
All right, Public Protector, thank you so much indeed for your time. So back to you, Bredan.
Thank you very much. The Khayelihle Khumalo speaking to Mkhwebane.